Hi, this is Degé Coutee with the Patient Advocacy Network at cannabissaveslives.org, and this is the next edition of the Compassion Flower Report, bringing you news and information from around the world about what's going on with medical cannabis. When I last did a show, we were getting ready to move into the legislative season, and a lot of the news and headlines the last several weeks have been about the many jurisdictions, states that are rolling out new amendments to try to have a better system in their state for medical marijuana. You'll see that in our most recent news digest that we have just gotten prepared and will be sending out by email, of course. To get email updates from us, please subscribe for our email list at cannabissaveslives.org, and every once in a while we will drop some news headlines in your box. What's going on with the legislative session here in California? Yes, there are a number of bills that are going through right now, and what Patient Advocacy Network did at the very beginning of the year is we sent a very general letter to every member of the Senate and Assembly in the California legislature with just basically the narrative that we've already known. I've already gone through it many times. In addition to the headlines going on around the country with how states are amending their rules to make them more effective, the news here in California additionally has been all about how it's been very problematic here, and not as many people got licenses as the state anticipated, and they haven't generated as much revenue from taxes because the sales really dropped, things of that nature. So we know that's going on in California. So what we're seeing this session is hopefully the beginning of what will start to fix some of that. So we basically started off by just a general letter letting them know the problems and what needs to be fixed. And the first thing we'll take a look at here are some of the bills that are going through the California legislature right now for those who want to be in the know. Of course, if you go to the bill lookup and type in cannabis, you're going to come up with about 59 hits. That doesn't mean that there are 59 important bills that are being heard right now. A lot of times when some type of other legislation or other act is being amended and it has to do with drug code, cannabis is going to appear in that very long list of all the other substances. So that's a lot of what this is. There are probably about a dozen bills that the industry see as the most important ones right now. These are the ones that PAN are taking a close look at. AB 1530, this is Assembly Bill 1530. This bill would reverse a policy by the Bureau of Cannabis Control that was just put into place that allows deliveries to take place anywhere in the state of California. This would reverse that, and it would allow, again, it goes back to allowing municipalities to permit or restrict, limit, or ban the actual delivery of cannabis in their community. I don't like this. I thought the BCC did a good job of allowing it all over. I understand, okay, if a municipality doesn't want to give a business a bricks and mortar definitive location, but I don't think it should be on the delivery driver to be concerned about if it was purchased through their system here and they're taking it here. As long as it's licensed activity, that the assembly or should be that concerned about it, but they're making it a big public safety issue. The other reason, the main reason that I don't like this and I support statewide delivery is for patients. Patients who can't get out, maybe they live remotely, maybe they don't feel well, maybe they don't have a dispensary close by. Having a delivery option is really good for patients. So we're going to be following this bill, AB 1530. The other one, of course, that we're following is SB 34. This you've heard us talk about here at the Patient Advocacy Network. This is what was the Compassionate Care Bill. It's now called Cannabis Donations. Um, it's going to exempt um, uh, licensees from the use tax for cannabis that's going to be given away for free to certain members, but a strict track and trace is certainly going to apply. But that bill is moving forward. It passed last time, it was vetoed by the then Governor Jerry Brown, but I believe it will make it through. It'll probably be a little stricter, a little tighter, but that's what they're doing for all of this. It's all about track and trace. It's about knowing where everything goes. The other one is AB 286. This is a tax reduction. This is going to take the excise tax down from 15 to 11, and it's going to temporarily do away with what people call the 148 tax, the cultivation tax on weight. Again, it's temporary. And what I find interesting about the bill as it's amended right now is there is the request that after a certain amount of time, the legislature wants reports on seeing if the number of applications for licenses have gone up and if the revenue that comes in from sales has gone up. So they are definitely doing this as an experiment to see if this encourages the type of revenue growth that they were hoping and anticipating. The other bill that it's a fairly new bill. It's just had its first reading here in less than a month, or maybe just about at a month. It's AB 37, and this bill, and some of these bills, these acts have longer names, called Personal Income Taxes, Deductions, Business Expenses, Commercial Cannabis Activity. They're saying that this bill is an offset to the federal 280E. It says in the bill that the intent of the act is to create tax equity for licensed cannabis businesses. So I think they're hoping that what they amend on the California side regarding this is going to help offset what they have to pay on the federal side. Again, that acknowledgement, which I'm glad that they're acknowledging that this is very, very expensive. And if they can't figure out a way to take down the cost at the register, we're going to constantly have a problem with patients and adult recreational users not wanting to go to the counter because it's too expensive. So that there are also a number of other bills as well. There are 2 or 3 that add some further definition and rules and guidelines for the track and trace. There's a party bus bill. So there's a few. Like I said, there's about a dozen that the industry is following right now. And you can see all of those on our blog. So again, you can sign up for email updates. I'll send you the digest that has all these headlines from around the world. And if you go check our blog at Cannabis Patient Voice, you'll get to see this particular story that we just posted about the bills in the state of California, along with the information and everything you need to know about how you can contact your elected official and let them know if you support or oppose any of these bills. And they need to hear from you. They absolutely need to hear from you. Your voice is very important in getting a hold of them and letting them know that you oppose or support any of these bills. And of course, if you have any questions, reach out to the Patient Advocacy Network. We are here to help. We love to educate people about how to get involved in this legislative and policy making process. It is very, very important, and it is fundamental to medical cannabis patients to have safe, affordable access to be involved in this process. Couple stories to share with you this edition, because I thought they were telling. Legal but scarce. Medical marijuana proves difficult to get, particularly in rural areas. This is DL Online News. This comes out of Minnesota. It says marijuana is slowly creeping into the scene of marijuana's medical industry. Whether people are for or against it, cannabis has approved to treat 13 qualifying conditions, from cancer to glaucoma to Alzheimer's, which was the latest to join the list. While the substance is legal medically, it's still extremely difficult for people with qualifying conditions, particularly those in rural areas like Becker County, to get a prescription for medical cannabis. There are very few doctors in the area who are certified to write a prescription for it, and even if a patient is able to find one of the few, the nearest dispensary to get the product is 45 miles away in Moorhead. Jay Westwater, MD, JD, and CEO of Minnesota Medical Solutions, the medical marijuana dispensary in Moorhead, Minnesota, says he believes that many doctors are apprehensive about cannabis for a few reasons, whether it's a lack of understanding or the outright fear of it because it's classified as a Schedule 1 substance, which puts it in the same category as heroin and LSD. Most doctors don't get education in medical school about the benefits of medical cannabis, he said, adding that the lack of understanding leads to a harsh stigma that gets in the way of many health benefits medical cannabis can provide. We had some patients who are also veterans, and they've talked about the significant stigma to try to find a provider who's willing to prescribe medical marijuana because the VA won't certify anyone. But it's not just the Department of Veteran Affairs doctors who aren't certified, it's most doctors. So this story goes on to talk about patients who would like to get off of other pharmaceuticals and use medical cannabis, but that like they're saying in Minnesota, it's hard to get. It's hard to get doctors who understand. And it's not just Minnesota. When if you subscribe to our digest and you get these stories from Oklahoma, Iowa, what's going on in Texas, Louisiana, Utah, you still see there is still a lot of work that needs to be done in the realm with physicians. But in light of talking about how it's sometimes it's hard to get access to cannabis because of people living rural, that was important to note that, because again, California is looking at overturning a policy that our regulatory bureau put in place to allow deliveries everywhere. And California is a huge state, and some of it, if you visit, you see the big cities, but most of the state is just state. And out there are patients that they're living a little more remotely. You've got elderly people who are kind of living together or living close to each other, and being able to have a delivery service come out and take care of them is huge. This next story comes from a blog called Physicians Briefing. This says medical cannabis decisions being made by users, not doctors. I found this very interesting because I saw this up close and personal while I was providing social services there on the front lines in medical cannabis collectives. A substantial portion of medical cannabis users stop taking or self-adjust dosage of pharmaceuticals. Many patients use medical cannabis without their mainstream health providers' knowledge, and further, they self-adjust their pharmaceutical use in response to cannabis use, according to a study published online in the Journal of Psychoactive Drugs. Daniel J. Kruger, PhD from the University of Michigan, Ann Arbor, and Jessica S. Kruger, PhD from the University of Buffalo, New York, surveyed 392 adults attending an annual public event advocating for cannabis law reform. The attendees were asked about their attitudes toward the utilization of medical cannabis and the mainstream healthcare system. The researchers found that more than 3/4 of the respondents, 78%, reported using cannabis to help treat medical or health condition. Medical cannabis users reported a greater degree of trust in medical cannabis compared with mainstream health care. Medical cannabis users rated cannabis better on effectiveness, side effects, safety, addictiveness, availability, and cost compared with pharmaceutical drugs. As a result, the use of medical cannabis, 42% of respondents reported they stopped taking a pharmaceutical drug, and 38% reported that they used less of a pharmaceutical drug. It's huge. Just under 1/3 of the respondents, 30%, reported that their mainstream healthcare provider did not know that they used medical cannabis. The survey brought other issues to surface, including a lack of access to mainstream healthcare, self-initiated treatment of health issues, little knowledge of psychoactive content, and heavy cannabis use. Those working in public health and medicine have an obligation to reduce harm and maximize benefits to the health of individuals and society, and thus serious consideration and scientific investigation of medical cannabis are needed, write the authors of the study. I'll read that again. Those working in public health, this is a quote from the authors of this study, those working in public health and medicine have an obligation to reduce harm and maximize benefits to the health of individuals and society, and thus serious consideration and scientific investigation of medical cannabis are needed. So I couldn't agree more. Patients know what's best. They know what's working for them. Doctors a lot of times don't. That's okay. They just need to listen to their patients. This story, I think, it comes from someplace else, and I think it was reprinted in this blog, Multiple Sclerosis News Today. This story is a really interesting snapshot of the industry right now, and it comes from the East Coast. But I thought, one, it's well-written piece, and like I said, I think it really gives a good snapshot of what's going on in the industry as we transition from these mom and pop businesses, and we start to see what is possible now. Medical marijuana can help everyone, says Director of Maryland Cannabis Facility. Warning the reporter accompanying him not to take any pictures, veteran horticulturalist Michael Castleman punches an electric code and unlocks the door to room 209, nicknamed the Mother Room. Photography is indeed forbidden inside this living vault, which contains 20 phenotypes of cannabis plants thriving under the glare of 25 ceramic metal halide lamps for 18 hours a day. The plants, arranged in groups of 4 and narrowed down from an original 1,000 seeds, bear colorful names like Oro Blanco, Bubblegum Diesel, and Sunshine Daydream. This is the heartbeat of the whole facility, Castleman told BioNews Services. We keep mothers 12 to 16 weeks before we replace them, and we take cuttings every day. If anything happens to these plants, we're out of business. That business is Kind Therapeutics USA of Hagersburg, Maryland, which holds a license to produce cannabis products in Maryland under a management agreement with MariMed, a publicly traded company based in Massachusetts. The venture's various offerings contain both CBD and THC, the main psychoactive compound in cannabis. The company occupies a newly renovated 180,000 square foot facility and a 10,000 square foot processing lab that for 130 years housed the Staten Furniture Factory. Located across the street from a livestock auction house, the sophisticated operation now ranks among the East Coast's largest suppliers of cannabis for the U.S. medical marijuana industry. Hagerstown is very depressed, one of the most economically depressed areas in the state. So we're bringing life and jobs to this area, said Abigail Deal, Kind Therapeutics Director of Business Development and Sales. We're already Maryland's largest indoor cannabis grower. Kind's production lines include Calm Fusion, powdered tincture, chewable tablets, mango, lime, coconut, green tea, lemonade. There's also Nature's Heritage extracts, concentrates, vape pens, 6 types of liquid lucid mood vape pens advertised online. The slogan, elevate your mood without clouding your mind. With other entrepreneurs, Deal is betting that the expanding U.S. legalization of cannabis for medical use will boost sales of the company's products to treat everything from skin cancer to multiple sclerosis. At the moment, 33 states and the District of Columbia have declared medical marijuana legal. In D.C. and 10 states, recreational are also allowed, even though the federal government still considers marijuana in all forms illegal. Talks a little bit about international. It goes on to talk about last month Israel became the third country along with Netherlands and Canada to allow the export of medical cannabis. It's a really interesting article, and I'm gonna include it below. But I love that when all of this started happening and all this movement toward legalization, we heard that pardon me, that medical would be going away, and I didn't see that was possible. It talks about a study with Parkinson's patients. It talks about MS. It talks about a lot of different medical things in here. So it talks about Rick Simpson oil and all of these really wonderful things. So I wanted to share that. And like I said, I'll include the link below because it's a well-written article, and I really think it gives a very good snapshot of where the medical cannabis industry is possibly going. This next story comes from France 24. Cyprus legalized medical cannabis. I like to try to bring you international headlines. I usually give you an international headline at the top, including one here below, along with some other headlines here. Cypriot legislators on Friday voted to approve the cultivation and use of medical cannabis, joining a growing trend among other European Union nations. An amendment to the country's drug and psychoactive substances laws introduces provisions allowing the import of cannabis seeds and plants for cultivation for medical purposes. According to the law, licenses will be given to 3 producers during the first 15 years as authorities aim to attract firms with an international track record and prevent the product from ending up on the black market. Medicinal cannabis will be allowed on prescription to patients suffering from chronic painful conditions, including those associated with cancer, HIV, rheumatism, and glaucoma. Officials have estimated that Cyprus could see medical cannabis worth 180 million euros or 200 million US being produced every year, offering a boost for the state coffers. The Cyprus Green Party welcomed the move Friday with a statement saying, "We hope that the process will be launched immediately for hundreds of patients seeking an alternative non-chemical way to manage their health problems. Although we have proposed many more improvements to this legislation, we believe that the road to medical cannabis has opened in Cyprus." It added, over a dozen EU countries have authorized the use of medical cannabis. Greece in November issued its first licenses for the cultivation and processing of medical cannabis. So yeah, now we're adding Cyprus as another country. They're looking around them at what's going on, and they want to have their own. I think everybody's looking forward to having their own brand. I think people are seeing that this is international. It doesn't have to just be the Emerald Triangle. It doesn't have to just be Humboldt. It doesn't have to just be Mendo. That there's the whole world can just be covered in marijuana. It's great. Other international headlines: Germany cautiously embraces medical cannabis regulation. Growing our own inside an Australian medical cannabis farm. Uruguay betting on exports of medical marijuana. After a decade of testing, Israeli medical cannabis comes to the U.S. Medical cannabis is now in the U.K., but no one can get a prescription. So medical cannabis is everywhere. It's not a perfectly fixed system, but it is there. So again, if you want to subscribe to our email list, you can do so at cannabissaveslives.org. You can also check our blog. We put information there. Our Twitter page has headlines galore from all over the world about what's going on. There's some really neat things there. We have Facebook pages that cover ending cannabis prohibition, which I'm going to talk about more next time. We've got some follow-up to do with the California legislature, but I see that the real big shift and what's really going to help everyone with some of these stringent rules is to fix things also on the federal level. So we're looking forward to doing that. So I want to thank you very much for tuning in and watching. I ask you to please donate. Patient Advocacy Network is an educational 501c3. We do everything we do with your support. Donations are always tax deductible. You can visit our website at cannabissaveslives.org and click the donate button. Becoming a monthly sponsor would be greatly appreciated. Please like and subscribe and share this video. Follow us on social media. And until next time, I'm Degé Coutee, and this has been the Compassion Flower Report.